Welcome to the Food Junkies Podcast. Here, we aim to provide you with the experience, strength, and hope of professionals actively working on the front lines in the field of food addiction. The purpose of our show is to educate you, the listener, and increase overall awareness about food addiction as a disease with abstinence as the solution. Here, we talk about all things recovery. Most importantly, how to thrive rather than just survive. So stay positive, make a change for yourself, tell others about your change, and hopefully the message will spread.
When food addicts say they get food drunk, could they really be under the influence of ethanol created by processed foods in their gut? Welcome to the Food Junkies Podcast. My name is Dr. Vera Tarman, and I am your host today, speaking with Dr. Jananthan Paramsothy about auto-brewery syndrome or gut fermentation syndrome. Dr. Jananthan Paramsothy got his internal medicine training at Richmond University Medical Center in Staten Island, New York. Additionally, he has worked as an anesthesiologist and critical care physician in Sri Lanka. He has published a number of peer-reviewed articles, one on a study of auto-brewery syndrome. He is also a student in the Executive MPH program at Yale School of Public Health. We've heard a lot about the microbiome and its possible role in food addiction. We at Food Junkies are interested to know what role gut fermentation syndrome might be contributing to our food addiction as a result of the ultra-processed foods that so many of us are eating. Welcome, Jananthan.
I'm excited to be here. First of all, thank you so much, Dr. Vera, to be invited to this podcast. I'm so happy to be here.
I'd like to know, we always like to get a bit of the personal story. What inspired you to conduct such an in-depth review of this particular condition, which is relatively rare?
In 2021, and before starting my residency, I come across one of the pioneer and renowned gastroenterologist, Dr. Ishwara in Brooklyn, New York. He is also emeritus director of advanced endoscopy in Maimonides Medical Center. Actually, he's told the stories and he's a mentor of a lot of budding gastroenterologists. He told me about this rare condition called auto-brewery syndrome. And his close friend and another pioneer, Dr. Prasanna Wickramasinghe, who is also practicing in Richmond University, he actually started and did the seminal work in auto-brewery syndrome. And he's a state witness, expert witness in multiple medical legal cases related to the auto-brewery syndrome. So learning from them and being their student surely motivated me to write this article to spread awareness among the general public and the physicians.
Thank you. Can you give a thumbnail definition of what auto-brewery syndrome is, and then how rare is it?
Auto-brewery syndrome, or ABS for short, is an extremely rare medical condition that many people, including doctors, other healthcare professionals, may not be familiar with. In fact, it is so rare, it's often underreported and goes unrecognized in modern medicine. So what exactly is auto-brewery syndrome? In simple terms, it's a condition where the body produces alcohol internally without actually drinking any alcoholic beverages. This happens when the microorganisms in our gut, such as yeast or bacteria, ferment the carbohydrates we consume and produce ethanol as a byproduct. In some cases, this fermentation process can even occur in the urinary tract system, which is known as urinary auto-brewery syndrome. So now you might be wondering how rare is this condition is. We don't know the exact prevalence due to its rarity and the likelihood of underreporting, but it is reported in medical literature a handful of cases. But the actual number of people affected by this condition may be higher, and sometimes because it can be mistaken for other diseases and can go undiagnosed altogether.
Good. Can you give a little bit of the pathophysiology, like what's actually happening? What bacteria, what yeast, and under what conditions can this condition happen?
So first of all, let me talk back about the gut microbiome. Our gut is home to like trillions of microorganisms like bacteria, fungi, and viruses that we call the gut microbiota or the microbiome. And it's an interesting fact that the total weight of these microbes in our bodies around 1 to 2 kilograms, which is about the same size as the human brain. But it's not their weight that's impressive. The genetic material material of these gut microbes, this microbiome, is whopping 150 times larger than the human DNA. This gives them an incredible biochemical and metabolic abilities to support and complement many aspects of body function. In fact, the gut microbiome is so important. Nowadays, the scientists consider them as an additional hidden organ in our own body. So now let's trace back to the auto-brewery syndrome. There's a delicate balance between the gut microbiome is thrown off in when the condition like ABS, which leads to the overgrowth of certain microbes, especially yeast like Saccharomyces cerevisiae, Candida albicans, and some bacteria called Klebsiella. These microbes love to feast on carbohydrates, fermenting them to ethanol. So when someone with ABS consumes a lot of carbohydrates, these microbes go into overdrive, producing alcohol right there in the gut. As a result, the patient experiences intoxication symptoms without even touching a drink.
These microbiomes like Klebsiella and Candida albicans are not that unusual. They're not that rare. Is this anybody who has these in their gut can be predisposed to this condition? Or is there something else genetic happening as well?
There's a genetic factor also contributing to that. Some people have the tendency of, there's always a immunity and gut microbiome playing the interplay role between them. So what happens, some people, because of they have a condition like, let's say, diabetes, or sometimes they are predisposed to some immunosuppression. These microbes can grow in overgrowth, which can predispose to them to these conditions. I would like to touch base on the genetic alterations further in our podcast, and also the gut dysbiosis is the main culprit for this auto-brewery syndrome. So the gut dysbiosis, there are some studies that some genetic alterations in our own right can also lead to the gut dysbiosis. And other causes, like if somebody is taking long-term use of antibiotics. Anyway, the antibiotics is a life-saving medication, saved millions of lives, but if it's taken for a long duration, it actually disrupts the gut microbiome balance, and it also wipes out the good bacteria. And so this creates a space for an opportunity for these yeast and other bad bacteria like Candida and Klebsiella and Saccharomyces to grow, which setting the stage for the ABS.
Okay. And those conditions, overuse of antibiotics, is actually not that rare. So we don't have to have a genetic predisposition. We just have to be in the right environment for this dysbiosis to occur, right?
Absolutely right. Yeah. Because if patients are sometimes taking for some other reason, let's say somebody has a urinary tract infection for a long time.
Yes.
They might be on antibiotics for 3 months, and this predisposed to the gut dysbiosis, as we call it.
Okay. Give us an illustration of what the symptoms.
Let's create a scenario. Someone who's been struggling with these odd symptoms. You meet someone who feel dizzy, disoriented, even intoxicated without even touching alcohol. It's really started affecting their daily life. One day you meet up this person for a lunch and you notice they seem a bit off. Their speech is slurred, like how the alcoholics, and also they have trouble articulating their thoughts. They might even stumble a bit because of their lack of coordination. So it can be very obvious. So you can ask what's going on. They can tell you these symptoms like been happening for a long time, and it happens more frequently. Sometimes they will be in a mental fog and also have some memory loss. So they can't able to recall when it started and how the symptoms been changing over time.
And the person actually smell of alcohol as well, like their
breath?
breath?
Of course. Yes. Sometimes they can have these common symptoms like chronic fatigue, and also they can you can smell the alcohol in their breath. So this leads to some people quick to judge, and they can think that this person has been drinking in the daytime or in the work. And so we have to be aware of this, not quick to judge and treat the condition, and finding that they need the support they need because they've been struggling with this condition. Also, it's not only that, it also can affect the neurological symptoms. Like I mentioned, that they can have dizziness, disorientation, and also they can have this bloating, because these bacteria also produce a lot of gas. and fullness in their stomach and vomiting also. So it is a very big nightmare for the people who are struggling with auto-brewery syndrome.
You mentioned that one of your colleagues is considered an expert witness. I guess that means that he is asked to speak about this condition in defense of somebody who's been arrested for, quote, drunk behavior.
Of course, Dr. Prasanna Wickramasinghe, he's been an expert witness in multiple medical legal cases, who has been arrested for DUI and or maybe they have some other issues. So that's even the physicians, not to blame the general public, when the physicians sometimes quick to judge, because in medicine the common things are common. So if somebody is presented with the symptoms of alcohol intoxication, it's quick to judge that the person has been intoxicated. So he's been expert witness and a pioneer in the condition, and he is helping a lot of lives.
But you mentioned earlier urinary brewery syndrome in the bladder. As an addictions physician, we have to do urine screens. And occasionally with a diabetic, I will see alcohol in the urine. That's because they urinated sugar and the sugar fermented to alcohol. They weren't drinking. Is that the same condition? This is just because of their diabetes.
Yes, it is the same condition. The dysbiosis not only happens in the gut, it also happens in the oral cavity as well as in the urinary bladder. So what happens that if there's an overgrowth of yeast in the bladder, it gets the diabetics, they produce a lot of sugar, they pass a lot of sugar with the urine. So it gives them the substrate for the yeast to ferment on, so they can produce ethanol also. Not only that, this ethanol gets back into the body and they also develop this auto-brewery syndrome.
Back into the body?
Yes.
Now, you mentioned oral cavity, also in the mouth?
Yes. In the mouth also, sometimes the dysbiosis occurs. If the food stays in the mouth, like a little bit of tiny carbohydrate stuck in the mouth cavity, and this gives the bacteria the substrate, the yeast, the substrate, so they can ferment and produce ethanol in the mouth. So it can be like they will be more, other people can quickly judge is some ethanol that this person might be drinking or something.
What about if somebody's eating bread? Now, bread, if you bake bread, it smells like alcohol because there's a fermentation process that's happening with the yeast and whatever else. And if the person's eating a lot of bread, could there be an additional fermentation process happening then in the mouth?
Yes, of course, because high glycemic index foods, refined carbohydrates, it is very quickly, easily digest, and it gives the bacteria quick metabolic pathways to ferment this bread and other high carbohydrates to ferment it.
That's really interesting, because one of the reasons why I wanted you to speak with you, is it possible that we could have an auto-brewery syndrome on a subclinical basis? Person is eating refined carbohydrates, has the appropriate yeast because they're diabetic.
Yes.
You see a lot of people with diabetes, a lot of people with immune compromised conditions. It's a perfect storm, and they're eating a lot because they're eating addictively. Could it be that there's a subclinical component that is underdiagnosed because the person's not actually drunk, but they are feeling the effects of a mild alcohol?
It is a possibility, and you're absolutely right. And these symptoms also can be like very subtle. Patients can say fatigue, and sometimes they have a mental fog. So they won't have all these symptoms that I mentioned. There might be some symptoms they might be having and can go undiagnosed also.
I'm posing this as a question, and you're saying, yes, there's a possibility. We don't have the numbers because it's underreported. But if somebody were to say, hey, let's do a study on this, we could start finding some information. So I guess that begs the question, how do you diagnose this condition?
So the diagnosis, it's a multifactorial, because it is very challenging to diagnose because this ABS can mimic other conditions. If someone is experiencing mental confusion, dizziness, and even slurred speech, it's easy to assume, like a physician or in the ER physician, they can easily assume this patient must be drinking. Also, they can even get arrested for DUIs and brought to the hospital. They have this memory fog, like they can essentially have recollection of events, and it's very hard to get a clear history with these patients. Sometimes it also have to involve the family and friends to get help with the diagnosis process. So first, with all this information, it's a comprehensive medical history and physical exam is very important. And the next part is to make sure they are comfortable, they don't have the alcohol withdrawal symptoms, or they are not really intoxicated. So to make sure they are stable is very important. And also we have to do basic lab tests, complete blood count, comprehensive metabolic panel, and also sometimes the stool testing, because sometimes the patients also have other comorbidity conditions which can be also predisposed to this condition, like diabetes, some immunosuppression, or maybe even a leukopenia can also have this condition predisposed. The other part is to be collaboration with the neurologist and also the psychiatrist, because these patients also have other memory fog and they feel depressed or those. So it's a multifactorial approach to those patients. Then we start, let's say we are start suspecting that we have to give them a breathalyzer to check at least twice a day to see if they have these symptoms of positive breathalyzer test. If it is positive, then we have to do a blood alcohol test to find out that if it is that, is it correlating.
Could those numbers be the same as an alcohol drink, like 0.08 or 0.3, even if there's a lot?
It is possible. It is possible to have the same numbers. And also the stool testing, which can be also helpful, because sometimes, usually the lower GI tract already have a normal colonization of fungus. But if there's an overgrowth, you can have a large amount of stool testing. It can produce a large amount of results in the stool test. And also to do endoscopy, upper GI endoscopy, to collect the samples from the duodenum aspirate to find for gram stain culture, and also do antibiotic and antifungal sensitivity to find if there's a specific fungus that is present. So this can help to guide the treatment. And also I will come to the last part is the carbohydrate challenge test, which is the gold standard now, because it's a difficult condition. So carbohydrate challenge test actually helps to pinpoint the diagnosis, which I can elaborate if you want to talk.
Yeah. Is it expensive? Like, why not do that right from the get-go?
Because we need to confirm that to do one by one. Let's do the basic tests first, like complete blood count and metabolic panel, and do the breathalyzer test, and also do the ethanol test to confirm this patient is actually having this high alcohol level.
Okay.
Then do the duodenal aspirate as well as the carbohydrate challenge test. And also for this test, the patient has to be admitted in the hospital, because it takes sometimes even 12 hours to get the full blood test done. I can elaborate on that because there's a preparation. First, the patients needs to be fasting for 8 hours, and also they are social drinkers. They need to avoid alcohol for at least 2 days before the procedure. And it has to be corroborated with the patient's family, also the friends. And we need to collect a couple of demographics and clinical history before starting this procedure. Then the patient has to take at least around 200 grams of glucose. That's a lot of sugar, but it needs to be done. Then before that, we need to take the initial baseline level of alcohol level in the patient at 0 time. Then 30 minutes at 1 hour and 2 hours, 4 hours, 8 hours, and 12 hours. Sometimes even in 24 hours, because some bacteria takes these slowly ferment the carbohydrates. So sometimes they need to stay for a day. And at these time points, we will take the blood and check for ethanol level. So we can see the graph that it's actually the carbohydrates helps the bacteria to ferment the alcohol, and you can see the rise in ethanol level in the blood.
And that may not happen right away. That might happen 4 or 6 hours later.
Yes, definitely. Sometimes because the yeast, they are slow fermenters, so it takes time.
Which would make it really hard for somebody to actually recognize, it could have been something that I did earlier on that's causing this fogginess that I'm feeling right now.
You're right, absolutely. Because some people, they can feel it immediately, like postprandial, but it can even take 8 hours to feel the symptom. So they can't even correlate with the food they are eating.
That's really interesting. I can see that would be a challenge though, because you have to fast for a prolonged period of time and go into the hospital, and it's very costly when you consider all those factors. I just want to go back to the idea that those people who are often diabetic, they're on medications that are potentially suppressing the immune system, steroids, taking asthma puffers all the time, antibiotics, they're walking in fairly vulnerable. And then there's some level of genetic predisposition as well. Can you tell us a little bit about that?
Yes. So sometimes there's two enzymes that helps digest alcohol we are drinking. One is alcohol dehydrogenase, short for ADH, and other one is aldehyde dehydrogenase, short for ALDH. So there's certain genes, these genes, ADH gene and ALDH gene, has some variations between different populations. Interestingly, that some mutations in this ALDH variant makes the ALDH enzyme particularly slow. So let's trace back. I have to mention that these enzymes work together. First, the ADH enzyme takes the alcohol and converts it into aldehyde. Then the ALDH enzyme takes the aldehyde and change to harmless acetate. So these enzymes should be worked together hand in hand to
metabolize the alcohol from the alcohol that intoxicates you to a benign substance.
Yes.
Yes.
So some variants of ADH gene that can makes the ADH enzyme like a hyperactive. So it quickly transforms the ethanol into aldehyde quickly in the gut. So let's say the yeast ferment the alcohol and it quickly converts into acetaldehyde immediately in the gut, and it gets absorbed in the blood. And the other enzyme, ALDH, if there's a variant that makes the enzyme inactive, then these people are slow metabolizers of acetaldehyde, which turns the acetaldehyde into acetate.
Can I just summarize by saying that there are some people who are slow metabolizers of the alcohol metabolism and therefore are at more risk of intoxication?
Yes. So what they feel more symptom because they are not metabolizing acetaldehyde into acetate. So the acetaldehyde is a very toxic metabolite. It goes into the blood and it can produce symptoms like facial flushing and also nausea. So these people feel more excessive symptoms, but there's also blessing in disguise because they feel more excessive symptoms. They seek the medical attention immediately.
And that's what we call being allergic to alcohol.
Yes.
The others who are slow metabolizers, might that be an explanation for why alcoholism does have a genetic piece to it, that this might be one of the genetic contributions?
Yes, the slow metabolizers, they can be predisposed to alcoholism because they can binge drink and not even feel the effect of the acetaldehyde or acetate because they are slowly metabolizing the alcohol.
Okay, so now let's bring this back to the food. Yeah.
These genetic dispositions, and also if somebody is consuming high carbohydrate diets, it works in hand and makes the auto-brewery syndrome for some people worse.
Might that be the same people who might have a history of alcoholism? Because one of the things we see in the food addiction world, people who struggle with overeating, is that they had a previous history of alcoholism, they often hand in hand. Is this possibly an explanation, this genetic variant?
Can't say for sure. There need to be some additional research to provide clear-cut evidence to say that it is actually correlated. But it is safe to assume there can be possibly a linkage between the food addiction and the tendency towards alcoholism.
We're just throwing hypotheses out. I know that you're a scientist. I'm just trying to understand the behavior that we see clinically and that this is an intriguing possibility. We'll just leave it at that.
Yes.
It's an intriguing possibility.
It's a possibility.
Okay. So we've talked about the genetics. Is there anything more to say about the genetics?
There are some other genetic variants. They can predispose to, let's somebody is consuming carbohydrates and like high fructose. And there are some genetic variants that's been proven in studies. They cannot be like metabolize those fructose and those high refined carbohydrates. So it stays longer time in the gut. That also that gives them these yeast for more substrate for fermentation. It has been proven in studies.
It's making me think that a lot of the people in the food addiction field have the continuous glucose contaminants that they wear, that we should also have some kind of a blood breathalyzer with us on a regular basis, just as a point of interest.
Yes, that in recent times, there's a lot of interesting talk about gut microbiome. And it is getting more and more awareness, and we should give more attention to that, because nowadays they are saying that this gut microbiome can lead to a lot of diseases with as a dysregulation, and also including autoimmune diseases and cardiac conditions. And so we have to give more attention to that. And I hope these scientists are doing their work. And with my mentor's help, I can also contribute to this.
Yes, thank you. So I wanted to know more about what other foods besides carbohydrates might be implicated. Could food additives be part of the story? Something that...
Of course.
Yes. You elaborate a little bit on that.
The processed food and food additives increasingly scrutinized in the medical literature for potential impact on gut health and disease. In the modern diets, the food additives like artificial sweeteners, emulsifiers, and also the food colorant, these are found in a lot of processed foods like candies, baked goods, sauces, and also the dressings. Studies have shown these additives promote the growth of bad bacteria in the gut, and also reducing the good effects of the good bacteria, the beneficial effects of the good bacteria to maintain the healthy gut environment. So first, look at some of the food additive. It's titanium dioxide. It is like a white pigment used in processed foods to make the appearance and the texture looks good. And also it helps with the food packaging. So what happens, this titanium oxide, it promotes the formation of a bad biofilm like Candida species on the gut. And also it generally disrupts the gut homeostasis. So in other words, it is helping the bad bacteria to grow more easily in the gut. And there are some other food additives like mono and diglycerides, polysorbate. These also help. These emulsifiers helps to mix the oil with the water to make the smooth texture in like ice cream, chocolate, mayonnaise, peanut butter. So that also their studies has been shown in the animal studies that these emulsifiers, if it is consumed in large quantity, predisposed to not only predisposed to gut dysbiosis, it also predisposed to colon cancer, but it's only proven in animal studies. Not only that, the ultra-processed fast foods, like often high in sugar and fat and low in fiber, these also predisposed to a condition called leaky gut. What it means by that is that the gut lining and the integrity is compromised. So the bad bacteria and the toxin can easily get into the bloodstream. This leaky gut condition also correlates with this gut dysbiosis, predisposed to a lot of autoimmune diseases in the people. And there's other particles called the inorganic nanoparticles. It's the same thing like titanium dioxide, silicon dioxide. These silver nanoparticles, they also help with the packaging and help the food stay longer fresh. But this helps to also contribute to the gut, these bad bacterial strains.
Ultimately, what it seems to do is promote the bad bacteria and also slow gastric emptying or the metabolism of the food so that there's more room for these bacteria to then ferment and create this condition.
Yes.
All right. And sweeteners, you would include?
Yes. Artificial sweeteners also, it looks like that we are taking a diet approach with the artificial sweeteners, but it also promotes this gut dysbiosis.
Oh, sorry. Go ahead.
So what we can do, because we can't really avoid, because the food industry has been with the processed food. But if it is in moderation, and also if we mindful about what we are eating and reading the packaging, what's included, we can actually make a step towards supporting our gut health.
Yes. But even before we get to that, I want to ask the question, the GLP-1s, the like Ozempic and whatnot, one of the functions that they propose is to slow gastric emptying. Does it actually predispose a person to ABS?
Yes. So if there's one of the listeners who are not familiar with GLP receptors, again, it's like a medication that's very common nowadays as for type 2 diabetes and obesity. So this actually mimicking a hormone, that molecule is actually mimicking a hormone called a glucagon-like peptide GLP-1, and which also helps to regulate the blood sugar levels and promoting the feeling of fullness. It is that the GLP receptor agonist also, they slow down the movement of food, as you mentioned, the gastric emptying, and we also call gastric paresis. So even though it's helpful in managing the blood sugar level and also promote the weight loss, but it can have implications to hypothesize that in ABS, because as we know, the ABS is we produce alcohol internally due to overgrowth of yeast and certain bacteria, and the overgrowth actually often fueled by high abundance of carbohydrates. So this medication, as slowing down the movement of food through the digestive tract, it could lead to a buildup of carbohydrates in the gut. So actually it is creating a favorable environment.
I would think then that if a person is taking a GLP-1, they should try to avoid eating excessive carbohydrates for that reason.
Yes.
Yeah.
It is an intriguing question, but there needs to be a lot of studies to be done.
Yes, of course.
To prove it, but it's not an unreasonable hypothesis to consider.
It's another one of those intriguing possibilities. What about general treatment for ABS? What are some things that you suggest?
So first and foremost, some people can come with the alcohol intoxication, actually. So we have to make sure the patient is hydrated fully with the IV fluids and make sure that they can have a clear airway, and also to have, if they have, especially that alcoholics may have these nutrition deficiencies like folate and thiamine. So making sure it's been corrected before starting the treatment. The first cornerstone of treatment is depending on the severity. One of the main treatment is the dietary involvement, to change the diet, typically to a carbohydrate-free diet, at least for 6 weeks, or low carbohydrate diet, because this is the substrate that is fungi is fermenting on. So it is very challenging to have a total elimination of carbohydrates, but at least a low carbohydrate diet with the small amounts of fruits and vegetables, it's fine. But when it comes to the medications, since it is a yeast, it's the antifungal therapy is the main treatment. And nystatin is often the first line treatment because it has the minimal side effects and also well tolerated. But in the literature, sometimes they prefer the fluconazole first, but it has more side effects also. If there's a treatment failure with nystatin or fluconazole or itraconazole, then the patient has to be admitted and started on IV micafungin, which can be the last resort of treatment. In addition to the therapy, we have to start the probiotics. Usually the Lactobacillus acidophilus, it's a single strain. It has been proven in studies. It helps to recover the symptoms, and also it prevents the formation of Candida albicans. That's one of the species that ferments alcohol.
So we're talking like yogurt.
Yes, lactobacillus. It's mostly in yogurt. You can see the probiotic yogurt. You can buy it, and also you can get it as a supplement, and in addition to the antifungal therapy. And also to make sure that after the 6 weeks of antifungal therapy, to do a breathalyzer test again to check if the symptoms are gone, and also to get the patient's history. If it is positive, then you can even do another carbohydrate challenge test after 6 weeks to make sure that it is completely gone. If it is positive, then you have to repeat the antifungal therapy as needed.
What about the fecal transplant? That's a relatively new potential solution for various gut microbiome issues.
The fecal transplant is it is a new concept for auto-brewery syndrome, but it's been proven in other GI disorders like inflammatory bowel diseases, even in, let's say, somebody's having a C. diff, Clostridium difficile infection, and the fecal microbiota transplantation can be a good therapy for them. But in Belgium, in one of the studies, they tried for somebody who is having the treatment-resistant auto-brewery syndrome, they tried the fecal microbiota transplantation, and they've been successful with that. But it is a new concept in this field, so we have to have more studies to be actually accepted for the treatment for ABS.
My awareness of fecal transplants is that it's a unique idea, but they still haven't figured out out basically a palatable way to introduce it to the person? Is that through an enema?
No, usually it happens through the upper GI endoscopy. So they go to the small bowel, they introduce the microbiota. It happens through the endoscopy per se. So they have there's companies who give the good bacteria that that's been taken from the healthy individual, and they transplant it through via endoscopy to the...
Getting back to the food addiction world, where we have the perfect mix. So do you think that, again, it's along the lines of speculation here, one of the reasons why we see such a prevalence of food addiction, there is actually an additional, aside from the neurological dopamine surplus, stimulate the reward pathway, that there might also be an additional physiological addiction because of this low level alcohol.
Yes. So actually there are some correlations, as you mentioned, that food addiction and there's with the gut dysbiosis. And in some studies, it was proven that the people who are suffering with food addiction, they have a different microbiota and gut dysbiosis in their gut. Because when the food is processed, especially the high refined foods, there are some short chain fatty acids that's been produced. These short chain fatty acids actually modulating the neurotransmitters, especially serotonin and dopamine in the brain. So there's always a gut-brain axis. And if there's a gut dysbiosis, that actually dysregulate the gut-brain axis. So these patients, if they have a gut dysbiosis, their appetite can be altered because of the disrupted gut-brain axis, and which can be promoting their cravings for high sugary food and also not having the appetite, like a good appetite. They will be binge eating in most of the time.
And it might explain some of the withdrawal too, because some people do experience withdrawal, irritability, insomnia, even agitation, even diarrhea sometimes.
Yes, it can be really explained by the disrupted gut microbiome and also the disrupted gut-brain axis, because these short-chain fatty acids, and there's no clear-cut mechanistic pathway has been proven, but there's clear evidence that there's these gut dysbiosis and food addiction are clearly linked.
Okay. And as part of that gut dysbiosis is auto-brewery syndrome.
Yes.
Okay. Now, what about people who talk about having yeast infections all the time, either vaginal yeast infections or mouths or whatnot? Are those people also people that might want to be aware of the fact that yeast could also be causing some subclinical level of ABS?
Yes, it can. I'm not generalizing that everybody have those kind of symptoms, but it is a possibility that people who have this chronic fatigue, even now they are saying like irritable bowel syndrome. That's been always said. It's like idiopathic. We don't really know what is the cause. But nowadays, it is clearly mentioned that the disruption of the gut microbiota actually leads to the irritable bowel syndrome. And also these patients, you can clearly say they have altered mental issues. Like sometimes some people have anxiety issues, depression.
Or mental fog, as you said.
Yes. So it is clearly the main culprit is the altered gut microbiome.
What I'm really getting here is that it's not just auto-brewery syndrome, but many different bacteria which are in dysbiosis can be causing these mental conditions. And one illustrative example is ABS.
Yes, you're absolutely right.
By way of concluding, wrapping this information into suggestions, it sounds to me like you would be on board with suggesting a low-carb food plan for somebody who struggles with food addiction. Here's yet another reason that a low-carb food plan would be helpful for a food addict.
Yes.
Because it won't promote any potential gut dysbiosis, including auto-brewery syndrome.
Yes. And also the high fiber food. Nowadays, they are saying that having a high fiber in our diet, especially, and also I tend to like the chia seeds that has a lot of fibers, and these fibers actually promote the growth of a good bacteria. So having always a low carb but high fiber diet is the best way to come back to the good, healthy gut environment and avoid gut dysbiosis.
Okay. What's being done about this condition in terms of further research? We're talking about it as rare. We're having the discussion that it might not be that rare on a subclinical level. How can we know more about this? How can we promote more interest in this area?
Especially there's been like more and more, I have read a lot of medical literature since 2022, and there's more and more articles has been published to get an health awareness among the physicians and the healthcare professionals. But in the meantime, it has to be get awareness to the general public. So as a podcast for you, and it's been an interesting topic, you initiated, give the awareness to the general public. Also, it has to be done from the physician's level, and they need to educate the public. If somebody is having these conditions, they need to be educated. It is a possibility. There can be tests can be done and diagnose them and help them. I have seen some of the family members who reach out to me after reading my article about this, and I directed them to my mentor, Dr. Prasanna Vikramasinghe, who has been treating them.
Thank you. Are you seeing, as there's more discussion, more diagnosis, and basically more recognition that this is a condition?
Yes, it has been acknowledged, and it's been acknowledged also in the medical legal field. So if somebody is getting arrested for DUI and they are not accepting that they've been drinking, so there's a comprehensive testing has to be done, including what I mentioned, the carbohydrate challenge test, to help them also, some of the clients.
Takeaway from this discussion would be that there might be something other than just the neurological addiction piece, that there might actually be a gut dysbiosis piece to the food addiction that a person is experiencing. And would it be helpful if they literally did do a breathalyzer on a day when they're feeling particularly foggy? Would that be something that we could recommend as a start?
It is a possibility, yes. And I also have to mention there's another condition called SIBO, S-I-B-O.
Yes.
Like a small intestinal bacterial overgrowth. It cannot even be ABS. Sometimes these bacteria produce some other gases, H2S, methane, and all that. It's always better to seek medical attention. They feel the symptoms because the physician, the gastroenterologist, can guide them in the appropriate part and do the appropriate test, because ABS is one of the possibility, but SIBO is more common.
And why should we care about SIBO? What is SIBO in terms of?
SIBO it's in the small intestine. Like ABS, it is like some of the other bacteria that produces methane and H2S. These bacteria cause a lot of bloating because these bacteria are gas-producing bacteria. So people have more postprandial fullness, and they might even have vomiting. So they come to the clinic, and we do the breath test, as you mentioned, to find out if there's gas-producing bacteria. And we give them rifaximin. There's a therapy for 14 days. It's antibiotic. And after that, they take the probiotics, and it helps them with the symptoms.
Okay.
It is a similar entity. This ABS produces ethanol, and the SIBO produces a lot of gas, including the methane and H2S.
Okay. To conclude the takeaway, we can consider that the dysbiosis may be part of the syndrome that's happening with food addiction, and that maybe a breathalyzer would be useful, and the SIBO test. And then overall, that a low-carb food plan with fiber would be helpful.
Yes, absolutely.
What's up for you next in terms of your own work? So this is something that you did some time ago. What are you doing now?
I'm actually working with Dr. Ishwara and training under him. And my focus is to explore more about gut microbiome. And the more and more I learn about this microbiota, and it's been it's very intriguing field of medicine. And so I'm going to do more research on that, and also my future is to become a gastroenterologist. So I have a great mentor, and so that's my path forward.
Thank you. One more question, our signature question that we ask everybody. If you could tell a younger version of yourself something about your work in ABS or gut dysbiosis, what would it be?
I wish I could have started the research about this and reading about this earlier and to spread awareness. But fortunately, I have great mentors who can guide me in the right path and do more research and treat the patients as they come in. And the future is bright. That's how I hope so.
Thank you very much for spending this time.
Thank you, Dr. Vera. I appreciate it. And thank you for giving me this opportunity to be in your podcast. It's a privilege and a pleasure.
Thank you.
Thanks for joining us this week on Food Junkies, Recovery from Food Addiction. Make sure to join our Facebook group, Sugar Free for Life support group, I'm Sweet Enough. You can subscribe to our show in iTunes or Stitchers. That way you'll never miss an episode. While you're at it, if you found value in this show, we'd appreciate a rating on iTunes. Or if you'd simply tell a friend about the show, that would help us out too. Don't forget to pick up your copy of Dr. Tarman's book, Food Junkies, which is available on Amazon. If you have any additional questions, both Molly and Clarissa are food addiction professionals and work one-on-one with clients. You can find their websites and email addresses in the show notes. Be sure to tune in every Friday when our new episodes drop. As Vera loves to say, the power is ours.